Grüezi ragazzi, willkommen e bienvenue to Cannabis Science's LinkedIn Live for this week. To those of you joining us live, thank you very much for being here with us today. And for those of you that will be checking out the recording at a later date, thank you also very much for taking the time and having a peek. We do really hope that you learned something new today and that you enjoyed the session with us as well. Cannabis Scienza aims to combat the bottlenecks of the medical cannabis industry using the power of education and through the training of healthcare professionals on the effective use of cannabinoid medicines. In doing so, increasing access to medical cannabis for patients worldwide. Here on your screen at the moment, you actually see an overview of some of the services that we offer. And if you'd like to scan the QR code and get in touch with us, we're always happy to hear from you. Also, something that we are very excited about and very proud about is the upcoming launch of our Principles of Clinical Cannabinology Handbook. It's just around the corner. It covers literally everything that all healthcare professionals or even just people that are interested in the subject matter need to know, ranging from the endocannabinoid system all the way to clinical practices as well as regulatory landscapes across various markets in Europe. Also here, you see a QR code, and if you're interested in the handbook, please take a moment and sign up. Don't be shy in today's session. If you have any questions also, just drop them in the comments. And without further ado, today's LinkedIn Live is on the role of the endocannabinoid system in women's and sexual health. And with us today, joining us on this week's live is Dr. Shabnam Sarshar. Shabnam, thank you very much for joining us, and I'm really excited to hear what we're going to be discussing today.
Cool. Thank you, Vijan. Thank you for having me. I'm also excited to see where our conversation is going to lead us.
Absolutely. Thank you so much for being with us. And actually, before starting to talk today about the role of the endocannabinoid system in women's sexual health, I wanted to take just a little moment to have a closer look at our guest today, you, Shabnam Sarshar. So if you could just give us a little bit of background about yourself and introduce yourself to who still doesn't know you. Thank you.
Okay, so I'm Shabnam, 30 years old. I'm originally from Iran. I love plants, and I studied pharmaceutical biology and phytochemistry, which is in a nutshell the pharmacology of medicinal plants in Iran and Germany. And I get into the woman health myself pretty late, end of my 20s, when I started my research project, doctoral project for urinary tract infection and the herbs that helps with urinary tract infection. And some questions popped up. Why before menstruation we are more prone to get UTIs? Why menopause women are more prone to UTIs? And answering this kind of question led me toward to understand more about like female health, because unfortunately the education around that is very, very little. And yeah, that is basically what I love to do and why I'm here today.
Yeah, thank you for helping us change this. Let's just dive in immediately into some of the juicy questions that I wanted to discuss with you today. So for example, exogenous cannabinoids, so phytocannabinoids, if we're looking at the plant, can they have different effects on male and females? And is there any reason, if there is any difference, what's the reason behind that? And yeah, I guess this is like things that are still not particularly taken in consideration by the majority of medical prescribers out there.
Yeah, absolutely, Viola. There are a lot of not a lot of, to be honest, the research is in its infancy, in infancy stage, but the animal studies, also some clinical studies, shows that exogenous cannabinoids exert different effects in male and female. for example, there is a nice examination on mice which shows that female mice are more sensitive to the effects of THC, and for example, they get the same effect as male in a much lower doses. And also, when we look at the female and male population in terms of the drug use habits, the drug use habits, I mean, for example, men are prone to take a higher dosage of THC, and also the way that they want to consume cannabis is a little bit different from women. Also, the perceived effect, for example, in men, we see the increase of appetite more significantly than in women, and also the withdrawal symptom is a little bit different. But altogether, it shows that women are more sensitive to the effect of endogenous cannabinoids, especially THC, and we can answer to the why from two different aspects. One aspect is it could be the hormonal changes and the hormones in female body, because throughout our menstrual cycle, and women generally throughout their lifetime, we go through substantial hormonal changes, and driven by estradiol or estrogen. Other than that, there is some kind of studies, different studies that shows that endocannabinoid system has different kind of distribution in male and female. For example, CB1 receptor is more in female brain, but the potential and the affinity of CB1 receptors in female brain is a little bit higher. Also, the placement of these endocannabinoid receptor in women, it shows more binding in amygdala, but for men is more in hypothalamus. So all of this hormonal effect and all of this, the dimorphism distribution of endocannabinoid system, male and female body, push these different perceived effects.
Very, very interesting. Can you tell us a little bit more, looking at the full menstrual cycle, so not just the phase of menstruation, but also luteal phase and so on. So if I'm looking at these phases, at the complete menstrual cycle of a woman during her fertile years, can cannabis affect her in a different way depending on the time point of her menstrual cycle, and if so, in which manner? I know most of this is based on what we have from science and literature, even from preclinical, but gathering this information, is there some path that can tell us something about this at the moment?
Yes. So before I answer your question, there is 3 principles that if we understand these 3 principles, we can answer everything. First of all, the whole directive of life is a successful reproduction, and everything in female body is designed for a successful reproduction. Everything. It's so interesting. The second thing is that all of us, we are a bag of chemicals, and everything that we feel and who we are and how we feel psychologically and physiologically, it depends on these chemical interactions. And all this chemical interaction is happening in a complex feedback loop. And so the bottom line is about balance and homeostasis, okay? With keeping that in mind, I'm going to answer your question about the effect of how cannabis can, the effect of cannabis can be very different of the menstrual cycle. So menstrual cycle is mostly driven by E2 or estradiol, a type of estrogen which our body produces during our reproductive year. Estrogen has an unappreciated and very complex interaction with the endocannabinoid system. Actually, estrogen set the tone of the endocannabinoid, the expression of CB1 receptors, also the production and degradation of anandamide. And it's like that. When the estrogen start to raise from our if in the follicular phase, with that, the estrogen actually decrease the amount of FAAH enzyme. So basically the amount of anandamide rise in our body, and the rise of that anandamide is basically correlated with the anxiolytic effect of estrogen. And it's because of that we feel much more good before ovulation. So I always say that it's kind of we are naturally have a euphoric feeling before ovulation. There's so much energy, everything is good, because the anandamide it's in peak before ovulation, and because of that, in that part of, in the follicular phase, especially before ovulation, we need less amount of THC to get high, because our body is already full with anandamide. And it's when you look at it from the, evolutionary perspective and reproductive health perspective, is that our body wants to send out the signal, hey girl, everything is good, don't be worried, just go out, have sex. And that's exactly that. It's super, super interesting. And after ovulation, progesterone take the control, and progesterone has the opposite effect of estrogen. Progesterone actually increase the expression of FAAH, so the amount of anandamides plummeted. And like that, because progesterone is responsible for modulate our immune system, because our body think, if that girl get pregnant, I want to suppress a little bit, modulate the immune system, not that her antibody start to harm the fetus. And yeah, that's why and also they show it in many animal studies that before ovulation, it's most of the animals that have this endocannabinoid system shows a much more sensitivity to THC, and that's super interesting.
This is really fascinating, super interesting. And how does this change, for example, the moment we add to the factor, already complex factor, something like prolactin? So let's say when you succeed, okay, and you succeeded with what the biology, the selfishness of our genes wanting us to do. What about pregnancy and then breastfeeding? How does the endocannabinoid system changes? Because I guess still I get these questions a lot from mothers, either women that are planning pregnancy, or they just found out that they're pregnant. And of course, they want to know how is the interaction of the endocannabinoid system with their baby and their own health throughout this process. But I guess before even thinking about, entering something exogenous like could be phytocannabinoids, at first, I guess we really need to understand how does normally the physiology of our systems works. Can you tell us a little bit more about this?
So to be to be exact, when we think about the role of endocannabinoid system in female reproductive health, basically A to Z of the process of fertility is modulated by endocannabinoid system. Actually, now they are starting to use endocannabinoid biomarkers as predictor and indicator of a healthy pregnancy. Yeah. For example, exactly. So it's super interesting. I said A to Z, then I really like to break down a little bit that. For example, if we look at the ovaries, our ovaries are full with endocannabinoid component and endocannabinoid receptors, and they are responsible for formation and egg and ovulation. In fallopian tubes, they are responsible, the endocannabinoid system is responsible for transportation and fertilization of the egg. And that's so interesting, because in the fallopian tube, here you have your ovaries, here the fallopian tube, and here the uterus. The anandamide has a gradient, has a gradient concentration. So it starts lower when it's near to the ovary and get higher when it goes near the uterus. And that kind of gradient is super important for a successful fertilization and transformation of the fertilized egg into the uterus. And for example, anandamide in this fallopian tube interact with TRPV1 receptor of the sperm, and that actually helps the fusion of a sperm with the egg. And that's super interesting. Also in endometrial cavity, the endocannabinoid system is responsible for the implantation, for the movement and proliferation of the endometrial cell lines. So you see that from A to Z, everything is modulated by endocannabinoid system. And
For mentioning this is true, because absolutely the fine-tuning of endocannabinoids, of course, defines as well how an healthy pregnancy or not. And it's true that now we actually have parameters, for example, by checking the levels of FA, so fatty acid amide hydrolase, to actually determine how good a pregnancy will go. And it's surprising that it's still not used so much in common practice. But for any cannabinologists out there, actually finally integrating knowledge on the endocannabinoid system, finally this will start to change as well. And yes, wow, you're just triggering in me like plenty of other questions, but I need to check the watch. Keep us in check too. Thank you. I, of course, one of the easy questions that come here is whether you think that there is an effect, or if there are effects of cannabis, whether they are detrimental or beneficial on the fertility of women. And one example that comes to my mind, because now you were just touching on this topic, of course, is, for example, myself, I have a PCOS condition, so I don't produce that much estrogen. For sure, there is an interaction with the endocannabinoid system. And I wonder whether there is a good or beneficial or detrimental interaction between these two worlds. And I'm sure that on the other hand, there is like such a big spectrum actually of pathologies that are having this balance, whether that's hormonal or through directly at the tissue in the organ. So yeah, maybe it's different pathology for pathology. Maybe you want to touch on a couple of them. I don't know. Up to you.
It's super interesting. I mean, it's always, Viola, I think it comes down to the risk and benefits. And at the end, as we just said, it's all about this balance. It's all about this interaction of different molecules. And when we are introducing some exogenous cannabinoid to the system, with a normal monthly checkup, we can see if our hormones level are at the right level, and it's not, how do you call it, influencing our general health and well-being. It's super interesting topic that somehow to call it pathologies like PCOS, endometriosis, also like carcinoma, and these kind of pathologies also show a dysregulated endocannabinoids. So perhaps by that, bringing an exogenous cannabinoid can help to restore that balance again. And maybe perhaps because of that for conditions like endometriosis, cannabis is one of the most effective, treatments. And it's one of the highest rate in self-management strategies that women take. So because again, like PCOS and endometriosis and many other reproductive issues, it's a disbalance in endocannabinoid system. But again, we have to be very careful, as endogenous cannabinoids gonna basically affect all of the reproductive events. We have to be very cognizant that on the dosage, when do you use it? Like, because as I said, our hormonal level also change a lot. And during these months, we have to know when is the best time if we want to go on the cannabinoid treatment. When is the best time? The dosage maybe should be, how do you call it, some kind of titrated based on our estrogen level and so on. So that is something that's super interesting question. I have no definitive answer for that. And I think the research is still not there to give us the final answer. But at the end, like all of the drugs, it's like risk and benefits. If a mom, if a lady that want to get pregnant has ADHD, shall I cut off her on her ADHD medication, or should she continue on her ADHD medication? It's super hard to judge and super hard to like say a definitive yes and no, because first the mother should be healthy and in a good like physical and psychological condition to be able to have a successful pregnancy and then raise a child.
No, totally. Also, in there, I think it's important to pinpoint that depending on the type of product, aka depending on the pharmacokinetic that that product is intaking, there is going to be a different rate of metabolism. And we know that, for example, THCOH and so metabolites actually have a harder time penetrating the placenta. So if we really, is it better to get a mother off her medication if she has a chronic condition, or is it better to find actually the best fit for her and her future baby? And I think the latter is usually the best solution, but of course you need someone that actually really dig deep into the topic. I see the time is running, but I think there is a couple of topics I still wanted to touch because they're really, really important. One, of course, is not a pathology, it's just a normal process of our life. And I think it's fundamental to touch as well, if you can, on what happens to menopause. Like, do we have differences? Does our endocannabinoid system changes during menopause? Is there some benefits actually in boosting the endocannabinoid tone via phytocannabinoids throughout menopause, or the way around, like it's actually worse to activate the endocannabinoid system?
Okay, I'm actually super fan of using like exogenous cannabinoids for menopause years, because for the premenopause and menopause year, our estrogen level gonna deplete, and as we just discussed, that estrogen set the tone of our endocannabinoid system, and actually estrogen also, how do you call it, some kind of modulate the expression of endocannabinoid receptor in our brain. So depleting that estrogen cause all of that effects that we already talked about. And we also said talked about that when progesterone levels get higher, we have less anandamide, because progesterone actually increase the expression of the enzyme FAH. And so I think that's like cannabis therapy can be really helpful for the premenopause and menopause year. And actually that is some part of women health that is still very much under researched and underrepresentation, because it's so sad. Actually this transition to the menopause is a transition to a woman's wise years, and unfortunately the society see that as a okay, when you go to your menopause, you are not that much of a woman. And that's a very, very like wrong idea, and very wrong, how do you call it, looking at these amazing menopause years. And I think, I mean, as I said, unfortunately the research is so low. Anyhow, the research on female body is much lower than it should be, and in menopause even lower. But the fact that every year 50 million women come to their menopause years, it should be something that we should think of. And our lifespan is getting longer and longer and longer, and that's have a nice treatment and have a nice like menopause years. It's some kind of a human right, because half of the population goes through that kind of transition phase, and definitely we need some support to kind of balance that that hormonal disbalance that comes with menopause.
Totally. I'm just gonna make a educated guess on this topic, thinking, for example, one of the complaints, one of the issues that usually is associated with a decrease in estrogen is, for example, decrease of bone density.
Mhm.
And we know, at least from a lot of preclinical literature, that CBD actually can help fracture healing and can be a good fighter versus osteoporosis, which usually is one of the complaints that can come with menopause. So just throwing this out there in case someone in the audience wants to develop perhaps a
Yeah.
formulation, or run a clinical trial so that we can actually talk more science onto this. And I know, Vision, you're here, but we want to talk more.
Well, I wanted to actually bring up the point about research, and Shabnam, we've spoken about this before in the past, and I know you've looked into this quite extensively. First of all, just one quick question here, all right, for the members of our audience. But Shabnam, I wanted to ask you if you've noticed any differences in, let's say, the effort and the intensity of the research when it comes to researching, let's say, male subjects versus women subjects, and also just in general, cannabinoid research and that relationship with women.
I mean, there is like a great question. I cannot answer that definitely, but what I can say is that when it comes to the sexual sex, most of the surveys that I went through, and most of the surveys about like sexual health, the majority of participants were women, which is super nice. Mm-hmm. But when you look at the physiology and other stuff, now it's get better. But for a huge part of us clinical trial history, women was excluded from these trials. And the reason for that was that female body has so much like variation in hormones, and that's actually interfere with data, and we cannot have a nice data. And because of that, still some of the animal studies, they just use male animals because they don't want to deal with this fluctuation in hormones, and perhaps and definitely like different response that they get in different phases of menstrual cycle.
I confirm, as a used to be a preclinical scientist working with rats, I never used a female rat in any of the experiments I ran, and it's true, because it's easier, but then it's a less accurate reply that you can actually apply on the other population. And this also happens in other fields as well, like testing a car and so on. But that's probably for another story. I see that there is a couple of questions perhaps we can take and reply to. Hi, Heidi. She's asking you actually if you have any recommendation for specific cannabinoids or terpenes that we have some understanding that perhaps are best used for symptoms of menopausal symptoms, if that comes to your mind. And running onto this, on the other side, is there something around cannabis or some recommendation on how to manage premenstrual syndrome or discomfort during menstruation with cannabis and cannabinoids? Thank you.
Okay. Actually, for menopause and premenopause, I would suggest that we can go. We can, how do you call it? Go with much more with a better feeling, with more confidence through the chemovars, which has higher THC in that, and depends on what kind of effect you want to have. You can like select terpene profiles. The research is not there yet to show us what kind of exact terpene or what exact chemovar are going to do that. But I know that there are some companies that are working especially to, how do you call it, design and bring this kind of personalized medicine into the market, which is good. For menstruation and menstrual years, my personal recommendation is more like high CBD and balanced chemovars, because there was normally when they want to test the effect of the effect of cannabinoids on how do you call it, general reproductive system, the model that we use is rhesus monkeys, because they also have 28 days menstrual cycle and so on. THC, there is a new study, actually, new pilot study, which shows that THC really increased the length of menstrual cycle. For each milligram per 7 kilogram, the menstrual cycle was increased for 4 days, and it was a huge spike in FSH, follicular stimulating hormones concentration in the blood. Also, the progesterone and estrogen, both of them decreased, but not in a significant manner, but the trend is absolutely, you can see that it's like it's decreasing. There is one study, and that's so sad that I just found one study for 1918, which tested different cannabinoid like CBN and CBD. They didn't observe these effects on CBD and CBN even with 10 milligram per kilogram. So in much high. Yes, exactly, and that was also intravenously to these monkeys. So, I mean that's my personal. So sometimes it's like that. It's the stuff that you read, but also your personal like feeling towards something. And I am more tend to recommend balanced and high CBD chemovars for menstrual problems and PMS problems, and more like higher with type 1 and higher THC for menopause and premenopause, because actually one of the conditions that premenopause and menopause ladies complain is the reduction of libido, and that's help a lot. I mean, that help a lot because there are different theories that why cannabis female population more than male when it comes to like sexual health and pleasure, and that's why I recommend that also for for sexual
Well,
pleasure.
yeah, it was my actually was I wanted to try and touch the topic as well of the orgasm gap that seems
Yeah.
cannabis is filling, but there is no time, so we'll just have to schedule another live with you
We
because
have to make another one. Yeah.
this was just scratching the surface. But thank you so much to really tickle our interest on this direction. We open, I guess, the point of an iceberg, and there is so much underneath. So
Yeah.
thank you for at least giving us a bit of info in there, and now we can start to actually learn something about it.
Super happy to be, and I hope that we see more and more like female specific clinical design, really like the effect that see the effect of exogenous cannabis in different phases of men. And there is a lot that we need to discover, and hopefully we will see in the near future more studies that we can discuss about.
Shabnam, it was an absolute pleasure having you today, and it's always also a joy to see with what ease you speak about this subject matter. And thank you very much for your time. We will
Oh,
definitely be scheduling another one. And
amazing.
if anybody in the audience agrees that more prominence needs to be given to this subject matter, and more dialogue has to be happening around this, please drop this video a like so that more people can see it. Another big shout out to Shabnam. We will see you very soon, I'm sure. Thank you very much. And to everybody watching, see you next week. Same
See you.
place, same time.
Thank you.
See ya.
Bye.